video will cover DSAEK, Decimase stripping endothelial keratoplasty, and DMEK, Decimase membrane endothelial keratoplasty. DSAEK or DMEK is a technique where the diseased endothelial cells are removed from your eye and selectively replaced with a new layer of endothelial cells. These new cells are held in place temporarily by a bubble of air inside of your eye. Since sutures are not used in this modern technique, the corneal shape is preserved, which allows a more rapid visual recovery than a full-thickness corneal transplant. Usually, patients who have diseased endothelial cells due to Fuchs dystrophy or following cataract surgery with none or minimal scarring of the cornea are suitable for this procedure. This procedure usually takes about 90 minutes and may be carried out under local or general anesthesia, depending on your preference. You will be asked to lie as flat as possible for 1 to 2 days after the surgery, as we usually leave an air bubble in the eye to push the new endothelial graft into position. This air bubble is usually absorbed in the next 48 hours after the surgery. You will also be given drops after the surgery for your eyes. The dosage and frequency of these drops will be reduced gradually, as prescribed by the corneal surgeon. Your vision will be misty for a few days after the surgery, but it will improve over the next 3 to 4 months as the cornea gradually clears. This surgery avoids the need for a full-thickness corneal graft, which means the benefits are a better visual outcome, better visual recovery, less need for prolonged steroid drops after surgery, less chance of graft rejection, fewer surgical complications, and less risk of loss of sight. Risks of this surgery include graft dislocation or detachment in less than 15% of patients, and less than 10% of patients will have graft failure or graft rejection. About 5% of patients will experience temporary increased eye pressure, and less than 5% will have blurred vision due to macular edema, which is usually temporary. It's very rare to have a retinal detachment. An eye infection with loss of vision has a very low risk. After the surgery, you are likely to need some time off of work, likely 1 week or longer, depending on the type of job you have. We also advise that should the surgery be successful, you wait for 4 weeks before returning to sport or active hobbies. You should also not fly for the next few days after surgery. As with all operations, there are risks. It is important to discuss all of your questions with your physician at your next visit to determine if you are a good candidate for DSAEK and DMEK. We hope that this video was helpful, and we thank you for your time.